Welcome back to Med School Uncharted, where we explore the winding, unexpected, and inspiring journeys that lead people into medicine. Today, I'm joined by my internal medicine preceptor here in Guam, Dr. Constantine. She has such a unique story, from becoming a physician in Panama to later completing residency in the United States and now serving as a hospitalist and clinical educator in Guam. We're going to dive into her journey, her transitions, and what it means to build a medical career across borders and cultures. Enjoy. Thank you so much for joining me today.
Thank you for inviting me, Angela.
Awesome.
Very exciting.
Cool. I'm really excited to have you here. So let's start at the beginning. In Panama, students enter medical school right out of high school, which is very different than how we do things in the United States. Can you kind of walk me through what it was like starting medical school at such a young age?
Well, just to start, let me give you the context.
Yes.
We are talking about the early 90s.
Okay.
Right, when I was just 17, 18 years old. And at that time, Panama was just coming out as a young democratic republic after the United States invaded and removed our dictator, Manuel Antonio Noriega. So that's where I was taking all of these decisions at the time. My family was like middle class. My mom was a teacher. My dad was an X-ray technician. And at that time in Panama, there were honestly not many choices. Mm-hmm. So we had only one public university and one small private university. So the path in front of me was not something that I feel I really decided alone. One is so young at that time, or I was so young at that time, that because I was a good student during high school, the paths are usually, okay, you're either going to be an engineer or you're going to go for medicine. And the decision of that is what classes you liked during high school. Were you good in math and physics, or were you like biology? And that was my case. I liked biology. My dad was an X-ray technician, so there I went applying for med school. But it is quite different from the path in the United States. I would say that it's not deliberate, like the decision that American students have to make when you are going to your application. There is less maturity, of course, less preparation. I never shadow a physician.
Wow.
Before entering medical school. Like, that's how immature and not and innocent I was at that time, I guess.
Did you have like a mentor like a physician that you knew, that you were like, oh, that looks cool? So you didn't even have like a physician, like family mentor?
No, there was no physician in the family.
Wow.
It was, I guess it was the environment. With my dad, we would go and pick him up. We would go to the hospital or the clinic where he was working, and I would be always playing with the lead gloves. And I would always be putting the lead jacket and the lead gloves, and the smells of the chemicals in the X-ray room. That's the environment that I moved, but I really never asked a doctor what it is to be a doctor or shadow. That really never happened. So imagine the kind of lack of knowledge that I enter at that point.
Wow. So what was the biggest challenge of that type of pathway to becoming a doctor, and what did you find most rewarding? You can answer them separate, it's okay.
Yeah, so of course, starting so early comes with a lot of challenges. So if you can imagine, between the ages of 18 and 25, you're a young adult and you're really growing and finding yourself.
Right.
Imagine doing that during medical school, because the coursework of medical school is still really intense. So the most challenging part was really doing those things together. Like, I just entered medical school, and then you start thinking about the first time that you're a little farther away from family, the social part of your life. Boys come, boyfriends are in the mix then, and having to juggle that part with the coursework was very challenging, to the point that in retrospect, I don't think I really realized what it was that I had gotten myself into,
Right.
until quite late in my road. Probably, so medical school is 6 years in Panama. So I would say probably around my 5th year. Then I said, oh shoot, I'm gonna be a doctor. And then panic set in.
So during those 6 years, is that all just coursework, or did you have any type of like clinical training?
Yes,
during that?
it's a mix. Like the first, I would say the first 3 years is very theoretical, and then the last 3 years, then you do the mixing so then you start doing your clinical. Like we have similar to your white coat, but we get a white dress, like we change to white, and then we start going into the hospital. So we will mix, like if we're rotating internal medicine, we will go to the hospital in the morning, and then in the afternoon we will go to class.
Okay, that makes sense.
And that's how all of the clinicals went through the last 3 years of the education.
So after you finished medical school there, what was it like stepping into practice in Panama?
Terrifying.
How old were you?
At that time I was 18, 19, 20, 21, 22, 23 or
23?
24,
Okay,
23,
wow.
I think 23. So after you finish the 6 years of med school in Panama, you have then 2 years of obligatory internship, which is a rotating internship, just like a transitional year, I would say, here in United States. The first year is structured to be at the hospital in the city. So you're an intern in the hospital, and you rotate everything. Pediatric surgery, internal medicine, neurology, emergency room, all of the major specialties. Then the second year, they ship you away to rural area for 1 year. And as I said, at that time, I was finishing medical school, and I was very scared. I think that realization, too late, I feel, in my education, what it was, the responsibility that I would carry on was really scary. So it was very challenging to handle the whole clinical work. First year, to be honest, passed in a blur. It was so busy.
Right.
I barely remember. I just know that it was so hard. My second year was the most rewarding, I would say. Can I explain that?
Yeah,
that
please.
part? So the second year is the rural year. And I chose to work at an indigenous native community in Panama. They are called the Gunas, G-U-N-A, the Gunas. And for that, I would to go to their community, which is in the north coast, in the coast of north of Panama. We would have to take a small airplane that would go from Panama City to the islands, and then do island hopping until you get to the island that you are assigned to. So that's my first contact with island life. When during my second year, I was assigned to one of the areas. The Gunas have like 365 archipelago in the top. Around 50 of those islands are inhabited. And I was responsible with my staff doctor of around I think it was around 7 islands. And we had our small hospital and the house where we lived in one of the islands, and that's where the plane would arrive in one of the small atolls around, and then we would take a boat to the main island. But that year, it was a 1-year experience. I would be in the island for 21 days in a row, and then come back home for 10 days, and that was the break. And it was a life-changing experience because that was when I really experienced more independence as a physician. I was the one time, so many times the only doctor on island, and I got to learn more about population health. That's one of the times when I realized that many of the changes that we can do for a patient don't happen really in the clinic or in the hospital, but out in the community.
Wow, that's so different.
Yes.
I'm so happy you explained that. Wow, I feel like I'm excited to re-listen, because that's just a lot. That's a lot to have done in that year. That's amazing. So at what point did you make the decision to come to the United States?
That's a question that I thought about how to answer, because that's also part of the non-traditional way.
For sure.
Maybe the traditional path is that when you are an international graduate, is that maybe you have always dreamed to go to United States, and you have exposure maybe to people that have trained abroad, and you want to do that same path. That really was never my experience. I probably did, but I don't remember having a mentor or somebody that have trained abroad. So working in the United States was never into my life plans. When I was in Gunayala, I started thinking about public health, so I joined a public health master's in Panama, and that started opening my eyes to global medicine. But still, I was always thinking about staying in Panama. So what brought me to United States was my love story, and it's that I met this American from Delaware that went to Panama supposedly to teach English. He was my teacher of English, and I joined this course at the university, and here was this very handsome professor, and I fell in love immediately. And well, we became boyfriend and girlfriend, and then eventually that's what brought me to United States. When we made the decision that I would move to United States to join him in Delaware, never thought that I would be practicing medicine. I thought that I would be working in McDonald's, or that I would be working. I was super intimidated. So intimidated about American medicine. So I really came to United States with very open mind to just try to find a job or study again. I think that was my initial plan. I would just get into school and study something that I could get a job in. So that's what brought me to US.
Oh, wow. And then what made you take the jump to now I'm going to apply to residency?
Yeah, so what happened is that I got a job as a clinical scientist for a pharmaceutical company, Wyeth Pharmaceutical. Now it was purchased by Pfizer, but at that time, I started working in a clinical trial, and I was the one in charge of receiving all the serious adverse events reported by the investigators. And during my time at Wyeth was fantastic. I really loved it. It was the safety part of the clinical trial was super interesting. But I got to meet American doctors that were working in there. And they encouraged me. They saw in me more than what I was seeing in myself. And they said, you should try, you should study, you should take the exams, we would write letters of recommendation for you. And I said, okay, I should try. And I studied, and I passed the exams, and they support me the whole time, and I matched to internal medicine.
So is there a cutoff where you would have had to do that in a certain amount of time? Does that make sense? So like if you're a physician in Panama, you move here, you still have to like have like a working license to do that, or how does that work?
There is nothing written about that timeline, but but the programs prefer to have people that have been working clinically and that have not had a long time before since graduation. So program directors will many times filter out from graduation date. Like if you have more than, I would say, 4 or 5 years, it depends on each program will make their decision. But if you have graduated more than 5 years, then your ability to enter a program gets a little harder. I was 8 years from graduation, so I was like right at in the cutoff. So I feel really lucky and blessed that again my program director saw also something in me and accepted me.
Yeah, the reason why I ask is because we talked about this before. When I was pre-med, finished all of my pre-clinical, all of my pre-med prereqs, I applied to med school, didn't get in. And then I took like a 9-year gap between retaking the MCAT and reapplying. So I can appreciate how difficult it is to study and pass a test after having taken time off. And I know it takes a special program to be interested in an applicant like that. So I'm glad that you found that.
There are programs out there that look beyond just those timelines. It does take a little bit more effort from the applicant to demonstrate that, look, I have been actively clinically, I graduated a long time ago, but I have really the commitment and the desire to start the residency or additional training. But there are many programs out there, both I think at the at the undergraduate and the graduate level, that can see beyond dates of graduation.
Okay, so I think we've kind of touched on this, but I'm going to ask this kind of like as a structured question, just because it's important to me, and I think it's important to some people that watch the channel. So one of the themes of this channel is that there isn't just one path into medicine. Your story is proof of that. Looking back, how do you feel that your path shaped the kind of doctor that you are today?
That was a very good question.
I know. Sorry.
No, it makes one reflect a lot. I think when you have a career that is winding from the beginning, talking personally, it has made me a more adaptable person. It has given me more flexibility to appreciate that sometimes it's okay to deviate from the path that is the usual one, and to have adventures, and I like to see it as an adventure. Yes. Take little adventures out, and then come in back if that's what you want. What happens many times is that, and what has happened to me is that you take this little road or different adventure, and so many new doors open in front of you. But I think it has this non-traditional path open your eyes to more open doors, to different doors. It makes you more empathic to different ways to do things. So yeah, I think non-traditional paths, when you start from the beginning with a not the usual, it doesn't feel right at the beginning. When you are starting, and it was important for me to say this, I think non-traditional paths have a downside. It makes you insecure. It carries this sense or to me, it carried that sense that I didn't do the things right. Therefore, I have less knowledge or have less skills than my peers that followed the things how they're supposed to be. And one carries that insecurity throughout. 20 plus years since I graduated, and I still carry that sensation that maybe the things that I don't know, it would have been different have I followed the usual path. But I have found that the adventures that I have taken and that the different paths and the different experiences have become much more of an asset nowadays in my later stage. So although it doesn't feel quite right at this point, it will feel like, it will feel so much better later on.
I can totally relate with that, because for me, during that 9-year gap, I was always trying different careers and thinking about how much I really wanted to be a doctor, but I just really didn't feel like, I felt like the time had passed and it was just too late.
Yeah.
When I started year 1 of medical school, I felt like I struggled academically in the beginning because it was hard. A lot of my classmates had just learned biochem and just on physiology and anatomy, and I was trying to pull this information, like 9-year-old information, out to keep up, and it was very difficult. But with every challenge, I noticed that it kind of gave me that chance to make the decision that this is what I want. So I think even though I felt insecure, and sometimes I still do have that insecure feeling, the one thing that feels very concrete is that I know I want to do this, because I pretty much have to make the decision every day intentionally to do this and to perform. Does that make sense?
Yes, absolutely.
So I think that for me has been the biggest asset to being a non-trad.
Yeah,
so.
that sensation stays with you. It's not gonna go away. It's gonna it gets easier to handle, and as you grow, you will have this experience, and when you conquer that challenge, you will have in your memory that, oh, I felt that way, but I did it, and that will help you keep going. But I think that sensation of insecurity or that second guessing ourselves will always be, and I think that makes us better people. And it makes us better doctors. I think because you're always, it's a base for continued medical education. It makes you a person that, I'm not sure. I'm going to check it again. I'm going to review it. I'm going to take this course. I'm gonna review it. It makes you want to continue be better. I wanted to talk a little bit about residency, if that's okay, because residency in the United
100%.
States was totally another life-changing experience for me. When I was accepted to the residency at Geisinger Medical Center in Danville, Pennsylvania, I was, of course, really insecure. I had yet still not worked clinically with doctors. It was quite a challenge. And during the first 6 months of the internship, I broke down and I quit.
I did not know that.
I quit my residency. I said, I can't do this. I'm just going to go back to Wyeth Pharmaceuticals and be a clinical scientist forever. I loved it. I quit. I was having panic. I became really depressed, and I went to my program director, and she said, well, thank you for giving me this opportunity, but I can't do it. My program director was the best. She said, let's take time off. I took approximately two months out of my residency where I got treatment, I got therapy, and I came back so strong from that support that I received that I ended becoming the chief resident of my program for my 4th year, and then I stayed there working as an associate program director, which is when I discovered medical education. During chief residency and APDs, I discovered graduate education, my education path. During that time, Geisinger also offered me a scholarship, and they supported me to get a master's in public health, which I had started in Panama, remember? So they offered me to complete the master's in public health at Johns Hopkins Bloomberg School of Public Health. They paid for it, and that opened my eyes to the world. And that idea of becoming a global doctor came back to me, and that's why I decided to take another adventure to Japan.
So how did you start working in Japan and then in Guam? Because you're working in both places right now.
Yes, I do. So when I was after I was working in residency as an APD, the bug of adventure again bit me, and I decided to start looking for jobs. I first started looking other United States, but then I started clicking the international box. And one time this job showed up in a community hospital in Japan, in Hokkaido, and I thought that it would be a very nice one-year adventure, and I applied and I got it. So I said, let's go. I convinced my husband, and my 3 kids were babies at that time. We moved to Japan in 2015. That job was to teach Japanese residents how American-style medicine. I was doing morning reports, lectures, but it was non-clinical. At that time, we were really not ready to leave Japan, and I started feeling that I was missing patient care by my second year.
That makes sense.
I was missing talking to patients and taking clinical decisions. And I felt that to be a good teacher, you need to continue being a doctor, a clinician. So I was feeling that I needed to have that kind of exposure to be able to continue to be a good teacher. So that's how I started looking for jobs. And somebody mentioned Guam is really close to Japan. You should try there. And that's how I started looking around here, and I found GRMC, and they offered me a job, and I started working here as a hospitalist in 2017.
Wow. That's awesome. That's really cool.
So now I split my life.
Yeah.
I actually, because my husband and my kids love Japan, so now I still have that job as a teacher in a community hospital in Japan, and I commute. I fly from Japan to Guam. I work here as a doctor, and then I go back to Japan and work as a teacher.
So what's the biggest challenge to teaching in Japan?
Oh, that was quite a shock. So when I came in to Japan, you come with evidence-based medicine and guidelines, and when you are trained in a bubble, then you think many times that that's the only way to do things, right? Mm-hmm. And when I went to Japan, I realized that the system is completely different. In many ways, the training is maybe a little bit more similar to Panama. They also do medical school starting from high school. They have less clinical experience during medical school. So when they finish medical school, they also have a 2-year internship in there where they really get all their clinical experiences. In Japan, I realized that I learned that there is many ways to do things, and Japanese medicine is in the balance of medicine as a science and an art. Mm-hmm. We put a lot of emphasis on the scientific part. In my view, in the United States. In Japan, medicine is much more artistic in the sense that they use less population data to guide the treatment of a single patient. So evidence-based medicine is not as strong. It's present, of course, but it's not as strong as it is in United States. So that kind of change of mindset was challenging to accept. But now I think going back to that adaptability and that flexibility that our winding roads gives us, I think that has allowed me to be a person that has stayed in Japan for a long time. I have many colleagues that have gone and then they leave. It's difficult to live. Japan is wonderful to visit, and living in there requires a bit additional skills, and I think that adaptability has played a big role.
Yeah, that totally makes sense. So kind of transitioning to talking about practicing medicine in Guam here, you're kind of like, you're doing a couple things. Like obviously you're working as a physician in the hospital, but you're also starting a clinical training program here right now, which is what brought me here. What is it, I guess, what about practicing medicine in Guam has surprised you?
Guam has made me completely fall in love with medicine again. When I left United States, I think I probably had some burnout, and I needed that period of non-clinical work to heal and recover. And I have come to this small island, and I have recovered such passion for taking care of patients. I feel that my career has been like completely upside down, like starting from so insecure and terrified from clinical medicine to the point of trying to even avoid any career, to now really loving being there, taking care of patients and clinical work. And that has been all because of the kind of patients that we have here. The patient population is so wonderful to treat, even with all the challenges of this limited resources area. I think that has given me a meaning. You see much more meaning here. There is so many more possibilities to improve things, and I think that has made a big difference in my life here in Guam.
So what motivated you to want to start training future doctors on Guam?
Well, I think the fact that you see how difficult is recruiting people to come to work and stay here.
You're talking about as physicians, right?
Right,
yeah.
Right. And well, not only as physicians, but it's difficult to recruit all kinds of medical staff here, all kinds of health careers here. I seeing these kind of difficulties with the background that I had about in my experience at Geisinger teaching and then in Japan teaching. I carried over this. I started bringing some of my residents in Japan to shadow and observe here. And I felt that there were so many experiences. They would come and they would be so blown away by the experiences that we were having here. And I started seeing that colleagues were interested too. So talking to other people that have been interested in education, we all see this potential in our hospital and all centers here and the population to be a great center for education. So I think it was just, it's just required that we join forces with the different doctors that have this kind of interest here to get this flying.
Yeah, well, I am so happy that you guys decided to do this, because as someone who's been training here for about, I'm going on my 8th week now, I feel like I have seen so much. The patients have been incredible, the doctors, the nurses, everyone has been incredible, and I'm just so excited for the rest of my rotations here. I have no idea what else I'm going to see, but I agree, it's busy, and it's so rewarding to be a student here and to actually, like, sometimes I actually feel like I'm part of the team. Like, I actually feel like I'm helping, which is not
but you
something
are.
I know,
Gosh.
but like as medical students, like you don't expect that. Like you expect I'm going to come in and I'm going to try to be helpful and I'm not going to mess things up, I hope. And it's just like I feel like I know I'm not working here, but I kind of feel like I'm working here, and it feels so good to feel like I belong here. So
yes, that sensation,
it's been amazing.
that
yes.
you are making a difference.
Yes.
It's really palpable
yes.
here.
I can totally feel it. So yeah, we both agree Guam is an amazing place to learn and practice medicine. Are there any final thoughts that you kind of want to leave people with?
Well, yes. First, I wanted to thank you for the invitation to participate in your channel. I would like to thank NYITCOM for keeping and pushing for this contact with our island. This has been an island effort, and I think the college has done a great job contacting all of us around the island and showing respect for all of the providers around, and I think that has a lot to do with moving this initiative forward. I want to thank you, Angela, for having the courage to take this adventure, to come all the way here, so far away from home, and giving us the opportunity to show how much potential we have to be a good center for education, even though we are remote and we have limited resources. We have this, right now, what you need is probably not fancy technology. What you need is people that want to talk to you, that interact to you, that you want to feel inspired, and you want to learn the most common diseases. And I think that's all what we can offer you. Plenty of what we can offer you here in Guam, along with a wonderful environment and very friendly providers, teachers, and patients.
I agree 100%.
Thank you.
Yep, thank you. Dr. Constantine's story is such a powerful reminder that medicine isn't a straight line. It's a winding journey shaped by opportunities, challenges, and the courage to take big steps. I am so grateful that she shared her story with us. In a future episode, we'll talk about the incredible work she's doing in Guam. She's building an internal medicine residency program from the ground up. That's going to be a conversation you won't want to miss.